Imagine speaking on this stage after stalwart as big as Dr. Rao, and that on such a subject. So I'll be starting with some questions, and I'll be answering. I've gone through the website of NMC, and from that website, I have some questions for all of us, to which we are concerned in our day-to-day practice. So, first question: how many hours of CME a doctor should participate in 5 years? Answer: 30 hours. 30 in 5 years. Now, I must elaborate on this. As per new guidelines which are yet to be implemented, we all will be required to comply to this. It is compulsory for all of us. It is not implemented as yet, but when it will be implemented, we all will have to comply to this. 30 hours of professional education in 5 years. How many years a doctor should maintain medical records? We all are running hospitals, and medical records are to be maintained. But how many years should we maintain? Answer is, as per NMC, 3 years. For 3 years, we must maintain our records. In how many hours case paper should be given to authority, to patient, or when legally it is required? How many hours one should give it? This is also compulsory. You get only 72 hours. Which register is needed to be maintained by all doctors? There are so many registers, but one register which we usually, physicians, pediatricians, we usually do not maintain is registration of certificates. Whenever we issue certificate, we must have a copy of it with us. What are the important record for medical certificate? So when we give medical certificate, usually we give it on medical basis, that this and this disease, and we are recommending this leave or whatnot, and now is fit. That is what we write. But actually, we all need to take signature of the patient, or the one, in case of pediatric patient, one who is responsible. Then we must have address of the patient on the certificate. And lastly, we must put identification mark for that patient. So it's very important. So this is how routinely we are not doing this. Okay. Then important documents on which our registration number should be there. Which are those documents? There must be our registration number. First is prescription. Whenever we prescribe anything, we must have our registration number right. In case of government OPD, there has to be registration number plus name of the doctor who has prescribed. This is also mandatory. Then on certificates, naturally, and lastly on all receipts. Whenever we take money, we give receipt, and we must have our registration number. What registration number? The registration number of GMC, Gujarat Medical Council registration number. Then about fees. Whenever there is any procedure, whenever there is any intervention or admission, we all are obliged to tell the fees beforehand. Before operation, we must tell how much will it cost. If we expect something more in that, if we expect some other one may be called to help, whatever, it must be explained beforehand, and the fees must be given beforehand. That is also in our ethical guidelines. Now, whenever we refer any patient to specialist, now we are having a very good number of specialists in Bhuj, super specialists even. So quite often now we are referring for expert opinion. In that case, we are obliged to write down the summary, and the specialist must give in written his opinion or her opinion about the case. This is also mandatory. Now, every one of us must display fees in OPD, whatever for emergency case, for routine case. Usually we are displaying, but we must do this. then if we are not complying to this ethical regulations, then can there be punishments? Yes, there can be punishments. Is the list of misconducts are complete? This is a very important question, because if you read the NMC's guideline, lastly they are saying that we have given this XYZ list for compliance. It is not complete. There can be new cases, there can be new situations, there can be new occasions where something else than this can also come up. And that can also be taken care by this ethical committee or the redressal system. To which body complaint should be done? This is for patients. And I'll just include this question to just explain the procedure, how routinely this is done. Dr. Arun Gupta is a pediatrician at Delhi, and he is heading Delhi Medical Council, and he routinely naturally deals with all such cases. He's a good friend of mine. I'll post his good video in our group also. You all must go to that 1 hour video, very good video. But one thing I would like to tell you from that part is, whenever there is a complaint, the complaint may be to police, maybe to the medical council. Ultimately, it comes to medical council. All of the such if there is any case of medical negligence, then it comes to medical council. Now, medical council, when it receives the case, first it will ask the doctor to reply. Yes, sir, rightly saying. And I'll again emphasize what sir saying, that whenever we reply, it must be complete reply. Don't take it lightly, because persons, those who are sitting in the council, they are looking at how they can save us. So don't make blunders there. Don't take it lightly. Whenever there is notice from Gujarat Medical Council regarding any such case against you, give case paper, give your explanation, give your answer with legal help. Don't take it lightly. And more important part, whenever there is a case where you feel that you need to stress down something, just you put 2-3 lines on that. It must be readable in court what you have cut. It must be readable to the council and court what you have cut. It should be open to eyes to the judge that this part you have cut, and there has to be reasonable explanation for that. So we are not supposed to scratch like this and remove everything. It should not be there. Now, what is the time limit for awarding punishment if the case goes to medical council? The time limit is 6 months. Usually, they conclude their investigation and whatever the case goes to proceedings, and they give punishment or they dismiss within 6 months. At least in 6 months, they complete the case. Now, as we all know, we are governed by the ethics which were laid down in 2002, and again they were adopted, which may be updated on 2016, and again in 2023 they were updated. When they were updated, there was a huge hue and cry about few recommendations and few regulations they were made. And so, as of now, because of those objections, 2023 amendments are not in place. We are following 2002 only. So, why 2023 amendments are not implemented? What were the reasons? The reasons are as follows. We were required to write prescription generic only. All doctors, they were told that they must write all prescriptions in generic form. So there are many issues in generic. One of the biggest issue is quality we know. Second issue is whenever we prescribe generic, a chemist can decide what brand or from where he want to give drugs. So there are so many issues included. So medical fraternity said that this is not proper. This is not proper. We must not do like this. Then the second part is gift and sponsorships. So gift and sponsorships, as of now also they are restricted, but as we know that still CMEs and medical education is allowed. So this was to be stopped completely by new regulation. They are not as of now stopped, but in new regulation, whenever it will come, they will say that no sponsorship of any kind. zero sponsorship. Then we all know what has happened to Khati hospital case. That was Dr. Prashant Vazirani, and his degree was suspended for time. Then he went to National Medical Commission, and National Medical Commission halted it for time. And then National Medical Commission was given proof by Gujarat Medical Council, and then again the suspension is still in force. Okay. So these are the few things which I have taken from site of NMC. The big difference between NMC's guideline of 2023 and previous guideline is social media. As we all know, there was no social media before. Now we all have huge following in social media. We are posting videos, good videos like Dr. Vijay, and many of us posting good information, even medical sort of information we are posting on social media. Now we will be required, like according to 2023 regulation, we will be required to post only verified material on social media if we are posting as doctor. Then there can be no patient's discussion. We cannot discuss patients on social media in open. We cannot do it openly. Then we cannot post anything which is like testimonials. Oh, મારા patient મારી પાસે આવ્યા, હવે સાંભળો શું કહે છે. મને તો સાહેબ બે ગોળી આપીને હારો થઈ ગયો. That we can't post. સાહેબ બહુ સારી સર્જરી કરી, મને બહુ દુખાવો તો મટી ગયો. Can't post. Then we also cannot post photo and video on social media about the patient. Now these all regulations are for medical doctors, those that have done MBBS and plus. I don't know what are regulations for alternate medicine people, but now and then we are seeing on social media that all such sort of testimonials and patient discussion and all such sort of things are going on in social media. I hope government will wake up to that and that will also be stopped. Even we are seeing that ads are going on like that. Even when Supreme Court says that this ad is bad, you should not do like that. Still such ads are continuing. So I hope that these things are also taken care of by government. Now I think I have taken almost all the questions on this site of NMC. Still a few more information. I'll go through slides. Purpose and authority of regulations. Purpose is to establish clear ethical guidelines. Authority, Indian Medical Council, then now it is National Medical Commission. And scope applies to, as I said, MBBS and plus. Is the scope. Then core ethical principles. Patient-centered care. We must give care which is patient-centered. Patient must be benefited by our action. Professional competence. Whichever branch we are practicing, we must be competent in our branch, and we also keep learning about our branch. Then confidentiality. We all know, we have studied in forensic medicine, that whatever we converse with patient is very private and we cannot disclose something to anyone. Then non-discrimination. Recently we had one case where one doctor refused to treat a lady which was of some other religion, and then it was in social media. There was a huge hue and cry about that. No doctor can refuse anyone based on caste, creed, religion. Once a doctor has to treat each and every human being as human. Then physician's duty towards patient and profession. Towards patients, provide care with compassion and honesty, obtain informed consent for treatment, avoid unnecessary investigations for financial gain, disclose conflicts of interest like referral commissions. Now, I must make a note over here. See, we are taught since our college days that there should be no commissions in any kind of referrals or any kind of practice. Now, the other side what we are seeing simultaneously is there are so many government programs where the incentives are going on. So I think we all need to sit down with government and rethink about all such sort of systems and how they work for private practitioners and how they work for government. So, toward profession, advertise services ethically, avoid misleading claims, refrain from issuing false certificates such as fake sick leaves, report unethical conduct by peers to NMC and to State Medical Council. This is also one of the duty. On one side, we are told that we must be decent to our people, our fraternity, and on the other side, we are strictly told that if someone is doing wrong, you expose. That is also part of it. Prohibited practices, again, fee splitting, like referrals and everything. Then ghost surgery. You say that you are performing surgery, someone else comes and does the surgery. If someone comes and does the surgery, patients, they must know. It should be on paper. It should be open and like honest. Nothing wrong with it. But it should not be that you are sitting somewhere, someone is doing surgery in your name. Then any sexual misconduct and endorsements. Now recently, I think before a few years, there was a case with IMA only. IMA started endorsing something. I forgot the product, but IMA started endorsing something, and then someone went to court and that was taken back. So when a doctor cannot endorse anything, IMA also cannot endorse anything. That this Dettol is good or XYZ thing is given certificate by IMA that it is useful or whatever. Then professional conduct and record keeping. Respect other physicians and avoid public criticism of peers. Then medical records, as I said, maintain records. Now it is digital era, so it is bit easier for us to maintain records. Euthanasia. Recently, I think there was a discussion about euthanasia. Euthanasia is strictly prohibited. Now, one state, I forgot the name of state, probably someone posted, Maharashtra. And now they are allowed to withdraw the support, not euthanasia, but withdraw the support. Then disciplinary actions, when there is violations, there will be legal consequences, and naturally grievances will be redressed according to rules of law. Compliance and continuous amendment, stay compliant. Doctors must remain updated with periodically amended regulations, and adherence is crucial for ethical practice. Let me add to this, doctors are needed to be compliant with not only ethics and rules made by NMC, but there are so many other rules, pharmacy rule, clinical establishment rule. There are so many other rules to which we must comply. So it is not that doctor, we just see to NMC and comply to NMC. Not that. We need to comply to so many other rules also, and we must also learn about those rules. Then breach investigations. Ethical committees investigate all reported breaches, ensures rigorous oversight and accountability. Evolving regulations. The NMC regularly updates the code to adapt new challenges. Continuous evolution maintains relevance and effectiveness. Thank you so much. Thank you very much. Now and then we are seeing so many big ads in paper, but legally no one is actually can do such kind of publicity by ads. So when can we legally give ads? When we start practice, we can give ad. We can change practice, we can give ad. We can change address, we can give ad. Whenever we are going to leave, we can give ad. Then we can also declare our charges publicly. That is where legally we can do it. Then when can we print our photo? We cannot print our photo neither on our signboard nor in any of the ads. No photo can be published of a physician or a doctor or a registered medical practitioner. And when this question is very important, when doctor cannot say no to patient in emergency. Any patient comes to us, whatever is our specialty, a pediatrician. If heart attack patient comes, I cannot say no. I can do whatever I can and then I can refer. I must be able to show that I did something for whatever I could I did. That is what I should show. Is display of registration number is punishable? Yes, registration number, as I told previously, it is punishable if you don't display. Is non-record keeping punishable? Yes, it is punishable. 3 years we must maintain the record. Now, which prescriptions are punishable? Prescriptions, unindicated steroid, psychotropic drugs. Then selling Schedule 8 drug to non-patients. We can give prescribe to patient, but if a lay person comes, we cannot prescribe Schedule H drug. And also L drugs. L drugs are those drugs which are used in research. So we cannot give those drugs to public. Now, when a rural government doctor can be punished, 2 times absent from duty, he can be punished. When college or institute or government doctor can be punished, 2 times absent from duty. When authority comes, he can be punished. So this is something in nutshell. Thank you so much for giving me time.